Hi, everyone. I'm Elizabeth Hooker, Senior Director of Communications for Trinchero Family Estates. We are doing another session today with Dr. John Swartzburg. As you know, he's an expert on infectious diseases and vaccine hesitancy, and we are honored to have him with us again to answer some more very updated questions pertaining to COVID-19 and the Delta variant that we're all reading more in the news about. So hope you enjoy today's session. Please share it with family and friends, and thanks for your time. So without further ado, I'm going to get into the list of questions. The first one is that there are so many sources for COVID-19 information. Dr. Swartzburg, which websites, organizations, and news organizations do you recommend that our team looks at to get the most up-to-date, important, and factual information when it comes to COVID-19?
You're right, Elizabeth. There's a ton of websites out there. I really like the Infectious Disease Society of America's website, IDSA. It's called the COVID Real-Time Learning Network, and it keeps people up to date with what's going on. And it's available to everyone. Any website with a .edu after it is usually very reliable. The San Francisco Chronicle and the San Jose Mercury News for local information. They keep websites, they keep the data sites open and current, so it gives you a good idea of where things are. There's the COVID Act Now, I like a lot, and it's written in a way that gives people a sense of what's going on, but doesn't use a lot of medical language. The California State Health Department and the CDC are very good resources. The CDC, generally speaking, is an excellent resource. Johns Hopkins University has a great COVID site, and there's a site called CIDRAP, which is the University of Minnesota and the state of Minnesota, that's absolutely superb. I could go on and on, but that should keep you busy.
Great, thank you. And I want to remind everyone that we have a sort of static news COVID-19 tile on the blend. And so the health and safety team is looking at a lot of those resources on a daily basis and tracking them and doing a great job of informing our executive team and making those materials available. So always feel comfortable hopping on the blend to get some of that information. So the second question is, how is the Delta variant different from earlier strains of the virus?
Two ways. It's much more transmissible. And I think that's the major way. There's some evidence that it may not respond quite as well to the immunity we get from vaccines as previous variants, but it still responds very well. So those are the two major differences.
And is the belief that it is somehow deadlier than earlier strains of COVID-19, or is it really more about transmission, as you just articulated?
We're not sure yet. Most of the data suggests that it's not deadlier than any of the other strains. Its major claim to fame, if you will, is that it's more transmissible.
Great. So there are 3 types of vaccines now widely available in the US. Do you believe any of the 3 is superior to others in protecting a person specifically from that Delta variant of COVID-19?
Well, they all 3 work very well, and they primarily work very well in terms of preventing people from getting hospitalized and dying. That said, the evidence suggests that the mRNA vaccine, Pfizer and Moderna, seem to be better than Johnson & Johnson's vaccine. Those are the 3 that have an emergency use authorization. But J&J still works quite well.
Is there a group of vaccine hesitant people who should not receive a vaccine at this point, given what we know about that?
Well, there are a group of people who should not get the vaccine. It's a very small group. It's people who have had what we call anaphylactic reaction, which is an overwhelming allergic reaction to any of the ingredients in the vaccines. So if they had a vaccine in the past that had the same ingredients or overlapping ingredients with the COVID vaccines, that would be a group of people who should not get vaccinated, but it's an extremely small group. Interestingly, people who have a bad reaction to the first shot there was just a study published last week that suggests that they seem to tolerate the second shot even better. So I think the only people where it's absolutely what we call contraindicated, meaning they should not get it, are people who've had anaphylaxis either to the COVID vaccine previously or to an ingredient in the COVID vaccine that was also in a previous vaccine where they had the reaction.
Okay. So for those who are vaccinated and how they need to think about Delta, wondering, I think we've heard some stories of fully vaccinated people getting Delta. So I think giving us some clarity on, yes, can people who are vaccinated still get the Delta virus, and what should they expect?
Previous variants that we've dealt with, the vaccine has pretty much prevented people from getting a second infection. With the Delta variant, we're seeing a lot more of these recurrent infections in people who are vaccinated. And that's been disappointing, but not surprising, because the Delta variant, as I said earlier, doesn't respond quite as well to the immunity we get from the vaccine. But if you look at people who have what we call breakthrough infections, people fully vaccinated who get the Delta variant, and most of those people are asymptomatic, meaning they have no symptoms, but they carry the virus. Some of those people get just cold-like symptoms, runny nose, a little bit of a sore throat. A very small percentage of people get a little sicker where they have flu-like problems, that is body aches, respiratory stuff, and fever. The vaccines prevent almost entirely, nothing's 100%, but almost entirely getting you so sick with a breakthrough infection that you wind up in the hospital or dying. And that's really the bottom line from a physician's perspective, from the public's perspective, from public health perspective. That is, we want vaccines to prevent people from dying and getting hospitalized. And the vaccines continue to do that.
And so can you speak a little bit more about that sort of asymptomatic transmission and what that means when you're talking about the Delta variant that is, been demonstrated to be just so much more transmissible in of itself?
This is an area that we don't have a lot of information about. Yesterday, the director of the CDC said that they had some information, it's not been published, that people who are fully vaccinated, some people, if they get a breakthrough infection, even if they have no symptoms, will shed enough virus to infect other people. Again, this is brand new information. With the previous variants, we did not see any evidence that people who were fully vaccinated could transmit the virus to somebody else, but it looks like with the Delta, that may not be the case.
Okay. So for those people that are vaccinated, right, and as you've just said, can still transmit the virus, particularly this highly transmissible Delta variant, what's your recommendation in terms of attending events and gatherings? I mean, how would you deem their general level of risk for an unvaccinated person right now?
I think the risk to an
vaccinated person. Okay. Let's do that first.
Okay. For a vaccinated person, there is the risk of getting sick again, that is, having a second infection. Because of that, and because we don't really know how great that risk is, I think we all need to take a few steps back and be more cautious than we were being just a month ago or even 3 weeks ago. I think that clearly, even for fully vaccinated people, going into indoors in any public space or outdoors where you're going to be crowded together with other people, you should have a mask on. And that represents a big change and an unfortunate one. But we have to deal with the reality that we have a much more transmissible virus.
And so for unvaccinated folks, I mean, I think what you just said is interesting in terms of being really careful, even if you're vaccinated, for when you're outside. So for people who are unvaccinated, what should they think about in terms of their behavior, both inside and outside with the Delta variant?
If you're unvaccinated, you're putting yourself at an enormous risk. Recognize that the Delta variant is twice as transmissible as the strains that caused such a terrible time in December and January, infecting so many people, causing so many hospitalizations and deaths. And this variant is twice as transmissible as that one. So if you're not vaccinated, you're at really profound risk for getting infected. And if you get infected, you're putting yourself at substantial risk for getting hospitalized and dying. 97% of the hospitalizations in the United States today are in people who are not vaccinated, are not fully vaccinated. That is, they only got one of their two mRNA vaccines, Pfizer or Moderna. 97%. In California, that number is about 99%. So please get vaccinated. If you're not vaccinated, you're putting yourself at enormous risk, and you're putting the people around you at enormous risk. Because if you get infected, even if you're not so sick that you wind up in the hospital, you'll be shedding lots of virus and you'll be infecting lots of other people, particularly those that you're closest to.
And so can you speak a little bit about how this Delta variant emerges in relationship to the population of folks that we have who are unvaccinated, and what that means, and how we might want to think about future variants popping up?
Variants are produced by people who are infected and have no immunity to that virus. And so the virus proliferates widely in those people. Billions of viral particles an individual will produce. Occasionally, the virus will make a mistake in its reproduction and creates a variant. Most of those variants don't have an advantage to survive and die off. But occasionally one does occur, and that's what with the alpha, beta, gamma, delta, and so on variants. These are variants that can survive and infect people. And that's where the Delta variant came from. It came from people who were not vaccinated, who got infected and produced the Delta variant, and then it spread throughout the world.
For fully vaccinated people, what are you hearing, or what do you think will be the need for a booster shot?
I don't know. We know that to date, out to about 11 months now, that otherwise healthy people have a very good immune response to the vaccine. But we are seeing some evidence of that immune response waning over the months. There's a preprint paper that just came out yesterday that suggested that the vaccine remained very good after 6 months, but it wasn't quite as good as it was after 2 months. So we will see some waning of the efficacy of the vaccine. And I suspect that at some point, whether it's going to be in 2 months or 4 months or a year from now, we will need a booster shot. But that's just looking into a crystal ball and guessing. Now, if you're immunocompromised, or if you're in a very high risk group for having a bad outcome from COVID, we may see advice for those groups to get a booster sooner. And that could be as soon as within the next month or two. So stay tuned.
And obviously we're seeing some news about trials for children. What can you tell us about sort of the latest research on vaccine safety for children?
Well, the next group, we have safety and efficacy data and now an emergency use authorization for children 12 and up. The next group that we'll have data on will be the children between the ages of 5 and 11. And we haven't seen the complete results of the studies yet, but the preliminary results show that it appears to be quite safe and efficacious. And there's every reason to believe that data will hold up. If it does hold up, I think that we'll see an emergency use authorization for ages 5 to 11 sometime in late fall, maybe as late as early winter. If in children below the age of 5, there are two groups that are being looked at, 2 to 5 or 2 through 4 and below 2. And I don't think we'll see any data sufficient to get an emergency use authorization until sometime in the first quarter of 2022.
And in terms, can you speak a little bit about, obviously the large portion of our population that are children, right? And I think what you just cited, the FDA's emergency usage application, I believe, what does that mean? And I think how should parents feel safe giving their children these vaccines, and how that relates to standard FDA approval versus emergency use approval?
Yeah, the EUA, Emergency Use Authorization, is based upon the vaccines showing both safety and efficacy at least 2 months after the trials are completed. And the data has to be compelling for both of those things before it will get an EUA. The FDA full approval, which I hope to see for adults 12 and or children and adults 12 and up, sometime maybe in September or maybe as late as October, maybe even earlier than September, sometime soon. The full FDA approval says that the FDA has had a chance to not only look over the data that was used for the EUA, but also look at all the data that's been accrued since that time. So for example, let's say that the FDA gives approval to Pfizer, which will be the first one that'll get approval because it was the first one studied in September. It means that the FDA will have looked at all of the data that Pfizer obtained with the studies that were done by Pfizer and then independent researchers between last summer and up until August. So they'll look at a much wider swath of material.
Great. And should people think about getting flu shots this fall?
Absolutely. You know, it's just about impossible for me as an experienced clinician to differentiate between influenza and COVID. Frankly, you can't even tell the difference between COVID and a common cold in some people. So just to obviate confusion, it would be nice to get an influenza shot. But more importantly than that, if you have influenza, we have a drug for it. So we'll want to be able to make that diagnosis. So the flu shot will help prevent people from getting influenza and it'll help clarify whether you need the medicine for influenza. But even more importantly than that, you don't want to get influenza because it's a serious disease in and of itself. Not as serious as COVID, but a serious infectious disease. Every year it winds up on average killing about anywhere from, well, the average is about 30 to 35,000 Americans every year. So it's not a benign disease. So you want to protect yourself from it. And also, because we're seeing a lot of COVID, if you have people with influenza getting hospitalized and having to go in the ICU and being on a ventilator, it means we're going to have fewer beds for the patients with COVID getting hospitalized, going on to a ventilator in the ICU. So lots of good reasons to get in the influenza vaccine. And of course, if you get vaccinated, while the influenza vaccine isn't nearly as good as the COVID vaccine in terms of its efficacy, it does prevent about 50% of cases on average, which doesn't sound great, but you know, if I had a 50% less chance of getting influenza, I'd take it in a moment.
Great. So I think just to be really clear about what your prevention steps involving mask wearing, social distancing, all that kind of stuff, you know, knowing that we have obviously a large portion of the population are children who can't yet get vaccinated, how would you tell people to protect those folks, the younger members of their family at this point?
Yeah, we have a granddaughter who's 11, can't get vaccinated. And whenever we're inside our house or her home, she has a mask on, we have a mask on. Even though everybody else in the family, including my wife and I, are fully vaccinated. Take those kids out to other venues, indoor venues, as little as possible. Don't go grocery shopping with them. Don't take them to the stores. And if you have to, make sure they have a mask on, a good mask on. We have to use masking and social distancing as major tools that really do work to help prevent these kids from getting infected. But you know, beyond that, parents can't take inordinate risks because if they get infected and bring the virus home, they're going to infect their kids. So unfortunately, I wish I could tell you things that would make life easier, but Masking is not that difficult and really does work. And it's terribly important right now with the Delta variant.
Okay, I think that's great. And so what about for people, we've heard some stories, apparently people mixing various vaccines. Do they work if they're mixed?
I think the answer is yes. I said, I think because we don't have a lot of robust data to support that, but every paper I've seen, and there have been several now, has shown that mixing and matching works fine and doesn't carry any greater risk. The Europeans, most of the Western European countries are doing that now. So if you got Moderna, you could get Pfizer for the second one. If you got Pfizer for the first one, you could get Moderna for the second one. If you got J&J, you could get Moderna or Pfizer if you needed a booster. So the answer is yes. If you have a choice at this point until we have more data, and let's say you got Moderna for the first vaccine, I would get Moderna for the second, or Pfizer for the first, get Pfizer for the second. But if you don't have a choice, I would feel very comfortable getting a different one.
What do you say to, I mean, obviously there's a lot of debate in the news about mask mandates and mask wearing. And I think one of the things that I've heard is naysayers saying, you know, we wore masks all this time and we're still in this position where we've got variants and, you know, COVID is still coursing through the world. How do you address that commentary?
Yeah, well, I'm sorry that we have variants. I wish we didn't, but that's the reality. And we have to deal with the reality, not what frustrates us. In terms of mask wearing, if prior to the Delta variant, I felt fine about people fully vaccinated not wearing a mask. As long as I could be 100% sure that the people who were not vaccinated were wearing a mask indoors. But, you know, unfortunately, we've seen too many reports of people not vaccinated who would not wear a mask indoors. And they put everybody who's not vaccinated at tremendous risk. And they put people who are vaccinated now with the Delta variant, because it's so transmissible, at some risk. So the only way to, in my opinion, to deal with that particular problem is everybody wears a mask. Then everybody has that layer of protection. The way I look at it for myself, who's again fully vaccinated, is I've got a suit of armor around me called the vaccine. It's going to prevent me from getting infected most of the time. It's really good, but not perfect protection. It's so easy to add another layer of protection on if I'm going to be indoors with other people. That's called a mask. So I've added another layer of protection on. And then I mentioned earlier, there's some brand new information from the CDC that that I haven't been able to review yet, that suggests that it's even possible for fully vaccinated people to transmit if they have an asymptomatic infection. And so wearing a mask, even if you're fully vaccinated, will protect other people around you of the potential of you infecting them. So there are lots of good reasons to wear a mask indoors now. And frankly, I can't see any bad reason for doing it other than people don't like, it's uncomfortable for some, more for others than some others, but it is uncomfortable and nobody likes to have to wear a mask, but it's not putting you at any risk, and it's putting a layer between you getting infected and it's protecting other people.
Great. Is there anything else that you think we haven't covered today that you think you're seeing sort of pop up relating to the Delta variant or any other sort of part of the COVID-19 pandemic that we're still in the midst of that we haven't covered?
I think we've covered really the important issues that are occurring right now. We'll all need to keep our eyes on whether we're going to need a booster. For those people who are not vaccinated, again, I want to emphasize how critically important it is that they do that for themselves and for others. I want to just acknowledge again that, this has been a particularly difficult emotional time because we went through that horrible December and January, and then we saw things precipitously get better in in such a rapid fashion. And by May, we were, all of us, everybody was feeling quite encouraged that we were seeing the end of the pandemic. It was just around the corner. And early June, we felt the same way. So our hopes were really quite high, and then they came crashing down with the Delta variant. And that's been hard. It's been hard for me emotionally, and I'm sure it's been hard for everybody listening to this. And I guess just acknowledging how hard it's been is important.
Yeah, no, I appreciate that. Thank you again for your time. We really value your input and perspective. And thank you for helping us do our best to keep ourselves and our team and our families and our community safe. We appreciate it.
You're so welcome. Thank you.
Thank you.
Bye.